Hello and welcome back, everybody. Welcome back to the CAT Scan Guru podcast. I'm your host, Karinna Hogan. So welcome back. Hope you guys are having an amazing week. I know it's getting nice and warm here in the Midwest finally because you know me, I am tired of snow. And I've said this on probably every single podcast episode. I am not a fan of snow because I come from the West Coast. So if you guys are checking me out on TikTok, make sure you follow on TikTok. I am currently doing a Muscle Mommy Come Through the Journey with Me series in the next 60 days so I can get summer ready. So it's an awesome series that I've created because my fitness journey is like one of the things that I hold near and dear, even though I've been through a fitness journey about 100 different times in the last 20 years. But this time it's really something that I've prioritized. Some seasons in my life have really changed my perspective on it, and I have just taken it just by the reins and just stuck with it, which is amazing because physically, not only do I feel better, I look better than I did in my 20s. And I'm in my late 40s. Like I'm very close to 50, if you can imagine. If you guys see me on TikTok, you probably are like, you don't even look like, you're 48. Well, I am. Okay. So make sure you guys follow along with that journey. Make sure you subscribe to the YouTube channel. Lots of good stuff coming to the YouTube channel. Lots of videos are going to be uploaded for as far as protocol videos. So I'm going to make a playlist for that, so you guys have access to that. And I will start posting more on Instagram. I know I've kind of paused a little bit. It's because it's a lot, especially when I have two brands, because I run two different brands in my business, and it is a lot to keep up with. Also, you newer technologists, if you need guidance as far as protocols, make sure you guys get the CT protocol reference guide. It is available to you. Link is in the show notes. And you get access to 2 different courses plus an audio series in my schoolroom community. So make sure you guys check all that out. Get your protocol guide today. Get your pocketbook today. There's a mini pocketbook as well that I've created. So make sure you guys get your resources so that you can be the best technologist you can be, which I know you're going to just rock it. So everything is in the show notes, so go check it out. So let's get into today's episode. Today's episode, I'm going to kind of take a deep dive on the hidden skill no one teaches in CT, and that skill is clinical thinking. Now, as CT technologists, we're really not set up in a way to really think in a clinical aspect. It's more technical and more of, okay, here's the patient. This is what we need to do, scan, and then next patient. Kind of like the Ford factory conveyor belt, which that is something that we're not. But because of high demand, high capacity, and the over ordering of CTs, July effect is coming, guys. We just experience this where we don't really think very critically when it comes to, thinking in a clinical aspect. So what I want you guys to take away is that CT isn't just pushing a button. I know a lot of rhetoric has been going around about, we're just button pushers, or we just do the exam and we don't have to worry about anything else. And then you wonder why a radiologist calls and yells and say, why didn't you tell me that there was a critical finding on there so I can read this a little bit quicker? So there's kind of like that dynamic there. CT isn't about pushing buttons. Okay, we do a lot more than that. Okay, we do a lot of clinical things in CT. It's not about pushing buttons. What really just grinds my gears is when I see comments on social media where texts say, well, all we do is push the button. We don't have to worry about anything else. Yes, you actually do. Because if something goes wrong, do you know how to go in and take care of it? If a reaction happens, do you know how to go in and take care of it? Or are you just a button pusher? So that rhetoric needs to stop because it's uncalled for and we are not button pushers. Okay. Here's the other thing. Interpreting orders and making sure that correct protocols and correct scanning techniques are executed. So when we have a list of CT orders, we have to look at why they're ordering it. What's the reason the patient came in? So that we select the correct protocol and the correct scan is done on the patient. Now, we know as techs, a lot of these orders are just wrong, or they don't make sense, or the providers that are ordering it and the physicians that are ordering it, they have no idea what to order. And I always encourage them and say, a simple phone call saying, hey, I'm not sure what to order, but I'm looking to rule out X, Y, and Z. Now, if I'm not 100% sure, I refer them to the radiologist. But 9 times out of 10, we can always guide them in the right direction on okay, this is what the patient is here for. This is going to be the correct order. This is the correct protocol. This is what we're going to scan. So there is clinical thinking that we do have to do when it comes to interpreting orders and making sure that the patients get the right scan. Now, another point is there are some technologists that wait for direction instead of being the go-getters. I witnessed this time and time again throughout my career, where you have either students that are training in CT or you have new technologists that are crossing over from X-ray and they're waiting for some type of direction instead of just being the go-getter. You got to take the initiative, guys. Okay. The only way that you're going to learn and be successful and make sure that you can think on your own is you got to be a go-getter. You can't wait for a technologist to say, that case has been sitting there for 30 minutes. Are you going to do it? That rec has been sitting on the printer for the last 15 minutes. Are you going to scan that patient? You have to get up and be the go-getter. There is a difference between technologists who are lazy and technologists who are successful. The successful ones are the go-getters. And I know that's going to trigger some people, but we see a lot of laziness when it comes to CT. And a lot of it has to do with how the technologists are trained. The newer generation, we have to show them the proper way to do things. We can't just let them just wait for some kind of direction. That's not how that goes. Okay. So we have to be more proactive in making sure that we have a lot of go-getter techs. Now, another point that I would like to make is not knowing how to correct a mistake or adjust when needed. Now, this goes back to my first point on CT isn't just pushing buttons. So if CT is pushing buttons, how do you know how to correct a mistake? Or you need to adjust something. Let's say you need to adjust a technique, or you need to adjust a rotation time, or you need to adjust window levels and window widths. So that's why I say CT is not just pushing buttons. You have to have a lot of clinical thinking to know when there is a mistake, how do you prevent it and fix it right away? Or if you need to adjust it when you need to, or if you need to repeat a scan because you missed something. So a lot of clinical thinking goes into this. Then there's lack of confidence. I have to say, a lot of newer techs that are coming in, they lack confidence because CT is very complex. There's a lot of moving parts. There's a lot to know, and your brain cannot absorb everything there is to know. That's why I always recommend, please take notes. Take notes. Write it down. I'm Gen X. I got to write shit down, okay? I know like the younger population, the younger generation, they, have their iPads and everything is digital. They're very visual. I'm a very visual person, I will admit, okay? But I still need to write things down because my brain can't process everything. So whatever method that you have to remember something, use that because that is going to be that confidence boost that you need. And a lot of newer technologists lack confidence because either they're made to feel like they're not confident, they're made to feel like they're not learning properly, or it's the you should just know. No, we have to stop that shit too, where it's not where, you show them one exam and then you expect them to just execute it correctly the next go around. It takes practice and repetition to become good at a skill. When you're trying to be good at a skill, which CT is a learned skill, you have to practice and you have to repeat those exams over and over again. Then going back to my point, something similar is feeling dependent and unsure. Or you're dependent on who you're training with to just tell you exactly what you need to do. And then you feel unsure when you're out there by yourself scanning, the patients or executing what you need to do. You have to be more independent, asking questions, asking the whys, taking notes, saying, okay, here's this. What do I do if this happens? If, contrast doesn't enhance properly, what can I do differently? Well, this protocol wasn't correct. How can I adjust it next time or fix it? Okay. You have to be independent because you can't always depend on the techs that are training you or the techs that are working with you. Because not all of them are going to be able to save you if there's a mistake, okay? So you have to learn and be independent and be sure that, okay, yes, this is the correct protocol. Yes, this is what I'm executing. Yes, this is how much contrast I'm giving, okay? Now, there's some things that I want you to think about when it comes to making sure clinically we're thinking appropriately when we are doing the job and training. So more often than not is what is it that they're looking for as far as what they're ordering? So if they're ordering a CT of the head, for example, what is the clinical reason and without contrast is going to be appropriate? Okay. Now, let's say contrast bolus on a PE, this is another example, wasn't as bright or you can't really highlight the pulmonaries. So what adjustment can I do if needed to make sure that I get a better bolus the second go around if you're allowed to scan again? Because some facilities, they do have you repeat it. Or what can I do to adjust on the next patient to make sure that I have an adequate bolus? And the last point is, what protocol should I use for any type of exam? Let's say if you're looking for an SVC thrombus. Okay. What protocol am I going to use? So typically those are venograms. And is this the appropriate protocol? And to make sure that okay, when they're looking for this is the protocol I need. Then this is the exact, technical factors that are set up in the protocol that are correct. And this is the amount of contrast and, the delay after I inject contrast. So those are some points to think clinically. And honestly, with our CT training, we have to be on point as far as how we're training the new technologists that are coming in. We can't feed them to the sharks, guys, because I know there's some techs that do that. We have to make sure that they learn the proper way. So we have to set the example so they can follow the appropriate and successful example. So that is it for today's episode. Hopefully those points hit home. So make sure you guys follow on TikTok, follow on Instagram, subscribe to the show, subscribe to the YouTube channel where I give you all the CT education and all the CT tips and all your CT resources and needs here. So thank you so much for joining me in this episode, and I will chat with you guys in the next episode.